Hello everybody, I'm Dr. Yan Yu. I'm a family doctor in Canada. Like you, I also enjoy Dr. Glaucomflecken's humorous medical videos. In fact, I've wanted to make a reaction video from a family medicine perspective for some time now. I really wanted to respond because Dr. G pokes fun at some really important issues that are plaguing family medicine and general practice, not just in America, but in Canada and around the world. In fact, Dr. G's videos are so funny precisely because they call out the challenges we face as a profession. Challenges that are so difficult, if not impossible to fix. So might as well laugh at them, right? So before I begin, I just want to acknowledge that family medicine is such a diverse specialty. I practice full-scope, comprehensive family medicine, looking after people from all ages. And so this is the perspective that I'll bring into this reaction video. And even though I speak for myself, I do hope to explain to non-medical people why Dr. G's videos on family medicine are so funny, and simultaneously voice some of the concerns that many of us in family medicine share, to hopefully prevent some of them from having to go into therapy, like this unfortunate colleague we have here. Let's watch.
Good afternoon, family medicine. How was your day? That was pretty good. Anything interesting? I delivered a baby. Well, that's exciting. I admitted 3 patients to the hospital.
You can tell how hard he's working and how tired he is from his voice. He sounds like he has a continuous head cold. It's a feeling we know all too well.
Oh, okay. Sounds like a very productive. I discharged 2 patients. I called 6 consults. I completed 8 prior authorizations. I saw 30 adults and 10 kids in clinic, and I went to a quality improvement committee meeting. And I stayed awake. That's quite a day.
I also have busy days when I work 24 hours in a row. But I love it. I love the patient interaction, solving people's health problems. But often it's the paperwork and dealing with the healthcare system that gets in the way. I'll talk about that later. But first, I just want to point out that there's been so many reaction videos from other medical specialties to Dr. Glaucomflecken's videos. And my video is the only reaction from a family doctor so far. Why is that? So here Dr. G explains one of the reasons why. It's probably because we've been way too busy, not only looking after our patients, but also doing the paperwork and fighting the bureaucracy.
Yeah, and now I get to go home for some family time. Work-life balance. That's wonderful to hear. Oh no, I called the charts I have to complete at home, my children. Tonight I have 25 children.
Yep, can definitely relate. And it's not just because many of my patients are actually children. You know, just like how parents hang up pictures that their children drew, I also have the pictures that my pediatric patients drew for me hung up on the wall of my office. Something I'm quite proud of. But here, when he calls his charts his children, he's referring to the fact that we need to keep a documentation of each patient visit for all the patients that we see. And often our clinic days are so busy that we don't have time to finish that documentation during the workday, so we have to complete those charts at night. Myself personally, I also have other paperwork that I need to do at night, such as medication refills and reviewing patients' lab results and consultation letters. The work just never stops. I often have between 50 to 100 of these tasks to do every single night. And that's not just me. That's most of my colleagues who work in general practice.
Family medicine? This is not healthy.
Yeah, we know it's not healthy. You don't have to keep telling us. But family medicine is also beautiful, and I mean this in all honesty. It's beautiful because we know our patients. We know them super well. You give me a list of names of my patients, and I'll be able to tell you what their major healthcare issues are, what their major challenges in life currently are, as well as the family and social conditions in which they live, which may be contributing to their health issues. The fact that we know our patients so well is one of the main reasons why family doctors are able to provide great patient care and simultaneously keep healthcare costs down. We often don't need to do extensive and expensive investigations to solve patient problems because we know what they are already. In fact, data from the United Kingdom suggests that family doctors there see over 90% of patient encounters while only using 1/9 of the system's resources. Talk about value for money. And here in Canada, according to data compiled by the College of Family Physicians of Canada, adding 1 primary care physician per 10,000 people was associated with a 6% decrease in all-cause mortality, and increasing the proportion of primary care doctors was associated with fewer hospitalizations, fewer surgeries, and fewer emergency department visits. In addition, data has also shown that family doctors reduce healthcare system costs. For example, in my home province of Alberta, the primary care networks, which feature family physician-led clinics and teams, saved Alberta's healthcare system $120 million over the last 10 years.
Well, it sure would be nice if somebody could do all my charting for me. I know what you're trying to do. What? You're trying to summon a Jonathan. I heard he has really good hearing.
I want a Jonathan too. But Jonathans are expensive. And my money tree still isn't making any money.
You can't just shout a task and expect an ophthalmologist scribe to show up. He's here! Family medicine, you don't need him. You can find the Jonathan within yourself.
And I also don't have a Jonathan because of this therapist and who this therapist represents. To me, he symbolizes the bureaucracy that, on the one hand, pretends to care about family doctor well-being, while on the other hand, systematically acts to devalue family medicine. And this stuff about you can find the Jonathan within yourself, that sounds pretty patronizing to me. It sounds a lot like, oh, it's okay. You have hundreds of tasks to do every day, but you'll get through it. And no, we're not going to pay you for that work because you're a good doctor. You're such a good doctor.
But I don't like that Jonathan. I want the good Jonathan. I'm sorry, I won't allow it.
That sounds a lot like the system denying us the resources for us to do our job, even as our workload increases. And this was the case especially during COVID. During COVID, a lot of us transitioned to virtual care, looking after patients over the telephone or over the internet. And for over a year, during this time, family doctors in my part of the world were paid $38 for every one of these conversations with patients. That's $38 whether it was a 10-minute appointment or whether it was an hour-long appointment. Now, can you imagine paying just $38 to see the dentist? Or have your lawyer fees or vet bills come to only $38? Not only that, the $38 isn't the physician's take-home pay. Part of the $38 goes to clinic expenses, clinic staff, and taxes. Fortunately, this was recently changed in my jurisdiction. But during the last couple years, many of my family doctor colleagues actually burnt out and quit. So it's becoming rather hard to find a family doctor these days in my part of the world.
Yeah, okay. I'll just continue doing an impossible amount of work. Family medicine? People are taking advantage of you.
Yeah, like this therapist.
You need to learn how to say no. I can say no. Oh, really? Last month when admin asked you to extend your clinic to 7 p.m., what did you say? I said okay and cried about it later. And what should you have said? No? That's right.
Fortunately, in Canada, many family doctors are their own small businesses, and they can largely set their own hours. Then again, with funding cutbacks, especially during COVID, many had to work longer hours to pay for their clinic expenses and their clinic staff, and to be able to make a decent wage at the end of the day. Not because they want to extend their hours, but because they have to.
And next time the general surgeon asks you to complete his resiliency modules, what will you say? No. That's right.
General surgeons have not asked me to complete their resiliency modules, at least not yet. And they better not. But they have asked me to fill out forms for their patients, even when it would have been most appropriate for them to do so. The physician who operated on the patient should be the ones filling out the forms related to that patient's operation.
And when admin asks me to serve on the committee to come up with more committees, what will you say? No. That's right.
Yes, so I admit, I am on various committees. And no, I do not get paid for that work. And many of my colleagues serve on committees in unpaid roles as well. It's tough because we care. We want to do our best to improve lives for our patients and improve the healthcare system. And it's sadly just becoming acceptable for the system to ask doctors to do work for free and for doctors to accept what's called the passion tax. But even though we've always just known about it and accepted it in the past, maybe it's time for a change.
And when the CEO asks if I'd be okay accepting cafeteria coupons in exchange for my salary, what will you... Wait, what? I'll just say no. I want real money. I think you need a new job.
We can't, or at least I can't. I love this job. Me and most of my colleagues, we love the diversity of family medicine. We love being able to deliver a baby, keep a dying cancer patient comfortable, treat various skin conditions and mental health disorders, and still have the energy to sit on committees all on the same day. We love the relationships we form with patients and the fact that we're helping them live their best lives. We don't just treat sick people. We prevent people from getting sick in the first place. Right now, Healthcare systems around the world are functioning on the backs of family doctors, doing their unpaid charting and paperwork at night when they could be spending time with their real children and families. It's time we stopped forcing family doctors to pay the passion tax. It's time family doctors were paid fairly for the work that we do. And it's time that that pay recognizes the value that we provide for our patients and for healthcare systems. So if you're still watching this, good on you. And my request for you is that if you have a family doctor, thank them. We family doctors are really here for you. And it's time that the healthcare powers that be were there for us. Oh, and while we're at it, maybe even get us some Johnathans. Johnathans or no Johnathans, if these changes happen, then maybe, just maybe, fewer family physicians will need to seek therapy. And that's it. Thanks so much for watching. If you enjoyed this video, please hit like and subscribe because I will be making more reaction videos to Dr. Glaucomflecken and family medicine. That is, if I have the time. Until then, stay safe everybody, take good care, and see you in the next video.